Well, currently we are a little bit dumbfounded by what the exact cause of what we call exacerbations, which is a flare of the disease. So often, depending on the type of pulmonary fibrosis a person has, the flare is really dependent on what type they have. So for example, if it's idiopathic pulmonary fibrosis where we don't know what the cause is, then a flare often occurs when an individual is totally innocent bystander. They haven't done anything bad, wrong, or indifferent. It just happens. So that we can't avoid. But other flares can occur, we assume, from developing infection. So of course vaccination is a good idea. It may be a good idea to have a backup antibiotic available at home. So to start the antibiotic at the first sign of changes in the lungs, such as a cough or phlegm or change in color of the phlegm or high fever. Nonetheless, even if you do start something, you must contact your family physician or your chest or lung doctor as well. Then another thing that we can avoid, as I was mentioning, is simple things. So avoiding possibly getting bad heartburn or reflux. I think that reflux has been associated with a number of individuals who have had flares. So you can imagine that what happens with reflux is that you get acid from the stomach going into the lungs, and the acid is irritating. If your lungs are normal, it's still irritating, but if they're abnormal, it's more so. So that's another area we try to control with treatment and make sure that the individual is on anti-reflux therapy. Usually this involves medications that are called proton pump inhibitors, sometimes just over-the-counter antacids, and a variety of other management strategies.